Welcome to the House Calls After Show. Real Docs, Real Talk. This is the after show after our live show where we continue the conversation and we answer your most pressing health questions. And today we're talking about the overconsumption of alcohol during COVID-19. So many people are trying to cope. And it's important to also note that it's National Minority Mental Health Awareness Month. And so here to help us talk about this very important topic is Dr. Katherine Sanchez. Welcome, Dr. Sanchez, and thank you for joining us.
Thank you. It's so good to be here.
Listen, this is such a big topic. There's so much stress going on. People are over consuming. There's studies and research, even on the American Heart Association's website and articles talking about the fact that people are over consuming. What are you seeing?
Yeah, it's interesting. There does seem to be definitely an upward trend in liquor sales. Interestingly, the alcohol and liquor stores were deemed essential services. So liquor stores have not closed down during shutdowns. And in fact, many of the restaurants have been given the opportunity to sell their wine stock and to get rid of their inventory in order to A, continue to make some money, and B, continue to at least bring some level of traffic in. So yeah, it's up for sure. And people just have a whole lot more time on their hands.
So when it comes to alcohol, we need to know, is it really an addiction or is it just a bad habit?
So this is a really good question. And this is almost the eternal question, which sometimes we say as clinicians and when I'm working and we're working with individuals, only you can decide whether what you have is a problem drinking. So we know that women are at greater risk. Interestingly, whether it's because of size or body fat content, women are at greater risk for increased consumption, increased habit forming, and increase than overconsumption. Alcoholism is tricky. That tends to be more of a colloquial term. You'll hear people talk about their parents or family members that are alcoholics. In the clinical world, we call it alcohol use disorder. And we also do the same with other substances, so substance use disorder. When we think about dependence, there is some level, when you've reached the point of physical dependence, particularly with alcohol, it's a whole different ballgame, and probably most of us listening would not fall into that criteria right now. But alcohol use disorder seems to be sort of a slippery slope. We know it's progressive. We know that it's habitual. And we know that what it leads to is increased consumption, tolerance. Of course, we're all familiar with tolerance. But there are some other things as well that we pay attention to with that criteria. Some of the things that we look for is recovery from any given time that you're drinking. If you find that the next day it takes you a little bit longer to wake up in the morning, you feel a little queasy, you have to determine what you eat based on what you did the night before, then we're starting to really talk about some problem drinking. We also look for things like, did you end up drinking more than you intended to when you first sat down to drink or when you poured your first drink? Do you wake up in the morning and tell yourself, I'm only having one tonight? And then before you know it, you're at 3, or you've finished off a bottle of wine. So alcohol and alcoholism, though again, a colloquial term, alcohol use disorder is definitely a progressive disorder. And so what the things to really pay attention to, especially in your own self, is your own ability to moderate, to stop when you intended to stop, and whether you're still feeling kind of the consequences the next day.
That's so interesting, and it brings up a ton of questions. One of which is it hereditary? People do often talk about other people in my family have been alcoholics. How does that play out? Can it be in your DNA?
What we're doing, it's some of this, the genetics of alcohol use and alcohol use disorder are very much in play right now. There's a lot of research going on at that level. Some things have been, determined and picked up at the DNA level. But again, from a clinical perspective and what we say colloquially, if you know that there are people in your family, especially a first degree family member, such as a parent or a sibling, that have what anybody in the family has called alcoholism, you need to be paying attention, because we're pretty sure that there is some familial association. Now, just because you have a parent or a first degree sibling with alcohol use disorder or alcoholism, it doesn't mean that you're going to get it, but it certainly is an indication that you need to be paying attention and being super careful when you do drink, and really paying attention to all those warning signs. One of the things we really think is so that we know is so important with alcohol use disorder is that if you drink more than you intended to drink in any given moment on a given evening, and that not just one time, but it happens kind of over and over again, those are some pretty serious red flags that you need to be paying attention to.
I know you got so many of us thinking already.
Good.
But that's really, really good information. But you also spoke a little bit about women. Can you talk specifically about the impact on women versus men?
Yeah, it's interesting. It's not anything that we want to focus on in terms of weaknesses or something, some sort of deficiency in women, but more about the fact that women tend to become more habitual drinkers. And we're not really, again, not really sure about what it is. It probably has to do with more of a physical vulnerability, that is, being smaller. Body fat is a contributing factor, because alcohol is absorbed in fat. And so women have a higher body fat ratio than men do. And so those factors alone kind of are a setup for again, rather than calling it alcoholism, more problem drinking situation. And again, really about this notion of habitualness. So if we find something is habit forming, or if we know it's something that that we do every night, we do it when we don't intend to, we do it for more than we intend to, those are things we want to be paying attention to in terms of alcohol use disorder. Further down the line, it develops into things that are a lot more clear. As soon as there's any kind of issues around legal trouble, or the potential or a brush with the law, or the fact that the next day you think, I really shouldn't have driven last night, those are situations where we're kind of getting further along the alcohol use disorder spectrum and really starting to think about some, probably needing to make some change.
Let's talk a little bit about the health implications.
Sure.
What are some of the things that overconsumption, especially during this time and during COVID-19, but in general, what are some of the signs in your body that you
Yeah.
may be drinking too much? Or also, what are some of the health issues that come up because you're drinking too much?
Right. So there's a lot to say there. In terms of currently drinking, and when in your current drinking habits, if at any time when you're drinking, other than the occasional, wedding or celebration, if you wake up in the morning and you have jitters, or you have a little bit of an unsteady hand, if you have a queasy stomach, some of the things that are also associated, nighttime sweats, if you wake up, a lot of times people with problem drinking habits, again, talk about having a drink or two or more actually to get to sleep, needing that drink to go to sleep. But often there's that middle of the night disruption. You're awake 3 to 5 hours later with night sweats and kind of agitated and unable to fall back asleep. So there's that. There's the morning, feeling in the morning. If there's ever a time when you can't fulfill your commitments, like work or family commitments, because of your alcohol use from the previous night, that's a pretty big sign that there might be need to make a change. Long term, alcohol is associated with a number of different cancers. So while that was why I spoke to on the call, or on the interview, sometimes I know the Heart Association and some, not all of the heart literature, there's some benefit to one glass of red wine, but honestly, for the vast majority of people, alcohol is more of a problem than a benefit. And really, there's certainly no need to start drinking instead, because you think there might be a benefit. And honestly, all the evidence says you're really better off drinking nothing than drinking nightly.
Hmm. Let's talk a little bit about the brain
Yes.
because it does have an impact on the brain, does it not?
It does. So again, some of the things that lead people to quitting is that, again, if you're having troubles, and there's short term and long term. So short term, if sometimes during the day or on the day after, you are speaking with family members, somebody said you called them and you don't remember, even brief interactions with your children, but you remember the rest of the evening. Again, I'm not going to say they're blackout behaviors, because certainly when you reach the point of blackout, that's significant. But even little episodes of not remembering things from the night before has some pretty serious consequences. Certainly, there's alcoholic dementia and many of the brain disorders that are associated with later in life, that can be very serious consequences for chronic alcohol use.
I want to put this back in context of COVID-19, though, because so many people are struggling and they are trying to cope. And so, for those who are drinking more as a result of their circumstance, and their circumstance has not changed,
Yeah.
how do you recommend that they um, stop doing something such as drinking too much if that situation has not been resolved?
Yeah, and it doesn't look like it's going to be resolved for the foreseeable future, right? We're all going to pretty much be stuck in this place, possibly even this place of working from home for a long time. So, speaking to the downside, what people find themselves doing is, while our meetings end at 5 o'clock, when we were in the work world, we had our commute home, we'd change, we might take the dog for a walk. Those were things we might have done before we had our what we call the bewitching hour of wanting a drink or a cocktail. Now it appears people are reaching that hour a lot earlier in their day. So people are beginning their consumption right at 5 o'clock when they get off their last call. So this has created this setup for more drinking in a given evening. And again, it's the numbers that I said earlier. If you have 4 drinks on a given night, 6 drinks for a man, that's considered a binge episode. Certainly, you wouldn't want to do that more than once a week, because we still, even though we say 1 drink a night, we say 7 drinks in the week. So if you have one binge episode, you've kind of blown your drinks for the week, or you're certainly real close. So, coping. These are hard times. We're facing financial stressors. We're facing caregiving stressors. We're facing work stressors. It is coming at us constantly, even though we're at home and it doesn't feel like we're in a bad place. But there are things you can do. Um, One of the things that seems to be work really well in terms of habit is keeping track, really keeping a diary of your daily drinking, really understanding and defining your problem, a problem if there is a problem, before we start to come to conclusions about whether there is a problem. Track it, write it down, write down that bottle of wine or whatever it was for the night before. Keeping track, a daily diary of your drinking, is the first step. Then setting some goals about how much you want to reduce by. But where you were going with your question is thinking about alternatives. What can we do instead? How can we cope with stress? We know about all the things that people talk about. Certainly, exercise is a big one. But with alcohol, sometimes we need to do something a little bit more than physical activity. So distractions are really important. With sometimes setting up phone calls with family members or loved ones at that time of day when it's really hard. Call a parent, call a cousin, call a friend who you haven't talked to in a while. Anything that you can do to kind of interrupt that habit that we're in can help and can be a game changer, can really change the problem behavior by being taking initiative. So, hobbies, of course, watching movies, a big one. We've been doing a lot of baking in our house. Baking is fun and delicious, and yes, might has its own consequences in terms of weight gain, which is also a problem in the time of COVID. But sometimes it's sort of that greater good, and we want to trade off that really bad habit of using alcohol for something that might temporarily be not quite healthy, but certainly not as damaging as alcohol use.
Can you talk a little bit about the weight gain? I know that there are some people who have gone on alcohol diets to lose weight.
Yeah, it was. I think I've heard the term. Is it like alcoholorexia or something, or drinkorexia? I don't know, something like that. Actually, it's common in college students. So college students tend to, again, lots of times females tend to fast and not eat. And then again, this is also in the time of parties and things when people actually left their house. But um, fasting during the day in order to either compensate for the calories you're going to consume in alcohol, or to get a better buzz, or to have, to feel the alcohol more strongly. Both are things that people might do so that they don't gain weight, and or to feel greater effects from alcohol. But this is very dangerous drinking, and this is the kind of drinking that we pay really close attention to, because what happens is it's going to get a little technical here, but your blood alcohol content, your BAC, rises really fast if you don't have food in your system. And when your blood alcohol content rises really fast, that's when we start looking at blackouts and doing things that you might not remember, and being very dangerous in terms of injuries, even injuries around the house. We don't leave the house right now, right? But we see injuries of people getting injured in the bathroom, getting injuries while they're cooking because they started drinking a little bit earlier and may have a couple more drinks than they would when they're cooking. So lots of those dangerous behaviors, but especially, as you mentioned, in, I think, young women.
Wow. Listen, you've been a wealth of information. You've given us all a
It,
lot to think about.
it was easier when I had more time.
Yeah, that's why we do the after show. I'm so glad you said that. That's exactly why we do the after show, so that we
Yeah,
can do a deeper dive into these kinds of conversations and answer some of the questions that we didn't get a chance to answer earlier. So helpful. And
good.
really a lot for us to keep in mind during this time of COVID, where everyone's just trying to cope the best way they know how. And
That's right.
certainly we don't want to do more harm to ourselves during, or a period that's already causing so much. So any final words, anything that you wanted to say that you really want us to know that you didn't get a chance to earlier?
Yeah, I think I just want to emphasize the online community and the availability of support in the online community. If you think you have any issues or any problems related to alcohol, it doesn't necessarily mean you're an alcoholic, and it doesn't mean you need to go to a meeting right away. What I would encourage you to do, there are so many good websites. There's the National Institutes of Health, runs the NIAAA, National Institute of Alcohol and Alcohol Abuse. There's SAMHSA, which is Mental Health and Substance Abuse Administration. There are trackers. There are these really cool tracker apps that you can download to keep track of how much you're drinking, and at the end it tells you how many calories you've consumed, how much money you've spent, how much and it can also help you set goals. And so when you're tracking it, it just, again, just like a fitness tracker, it kind of helps you keep in touch with your goals. All of those things aren't one-time perfect solutions, but if you put a whole bunch of things in your toolbox, it really, in the end, can really help us change behaviors and change the behaviors that we want to change.
Well, you've certainly helped to keep us accountable about our alcohol consumption.
Good. That's the goal.
Thank you so much, Dr. Sanchez. And for those who are watching and you want to see the live show, just make sure you check us out every Monday at 11 o'clock Central Time. We have a live show. And of course, come back and join us right here on the after show. I'm Dia Direct, and be safe out there.
Learn more about house calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.